Leonardo. I'm from the first year of medical school here in Escola Paulista, and I'd like to do some questions just about the Congress and your relation with it. To start, basically, I just want to know a general point of view. Basically, how do you think the things are running through, how the Congress is running, the organization, the committee, things like that?
I've been incredibly impressed with the organizing committee ever since Marilia reached out to me probably 6 months ago. Everything has been incredibly professional, every detail taken care of. I've just been, your whole team is really, really remarkable. For you all to be medical students working on this, I don't know where you're finding the time to do it. You guys are doing a great job. And actually, after my talk, a few people came up to me and they said, how did you organize these nonprofits as a student, and how did you organize? And I probably should tell them to speak to the organizing committee for this event, because I think you guys have figured out how to organize things very, very well.
We've spent short time right here. I think we didn't have enough time to see the presentations, the poster, things like that. But what would you say to the congressman? Maybe something like a motivation message or something such instruction?
So I think that the most important thing for my talk is that everyone needs to be okay with questioning the way things are done. In medicine, we tend to think that professors and deans have all the answers, and that we just need to learn what they know. But actually, there's a lot of diseases where we don't fully understand how they work, and there's a lot of opportunities for young people like us to really be a part of changing what's known about diseases, and also changing the way that we go about learning about diseases.
Right. And based on your keynote, beyond your mom looking for prevent for cancer, and maybe your own experience as a patient, I want to know if you had something like a special motivation to put the things you had on your mind on work, right? Moving up with your projects and actually continue keeping up doing the things that you do currently.
Yeah, so those are definitely the main motivators for me. Having my mom diagnosed with cancer really gave me a laser focus on starting an organization in her memory to help other people dealing with illness and loss in college. Of course, it also gave me a laser focus on becoming a doctor. I wanted to treat patients like my mom. And then my own illness made me want to figure out how do you stop this disease, because it's really not just me dealing with this, but thousands of other patients around the world. And then when I saw how little was known and how really slowly things are moving forward, that encouraged me to try to come up with a new solution.
Right. And then what made you accept our invite and come to Brazil and join Braincoms?
I think it was a combination of things. Maybe first off, I saw the videos of previous events. I saw how well the meeting was put on. I also have been working with Giselle Colleoni, who's an excellent hematologist here in Sao Paulo. And so I knew it would be an opportunity to see Giselle and to catch up on our work. And then thirdly, I was really excited about the idea of being able to hopefully identify some students here in Sao Paulo or other areas of Brazil or other areas of Latin America who would be interested in helping to expand our network and actually be able to help patients and doctors throughout Latin America. I think that what we've learned from the CDC and from Councilman's network is that a group of medical students and PhD students and business school students, they can really change the world. And you just need to have the right problem to focus on and the right system for resolving it. And I think that based on what I've seen here, there are some really impressive medical students who maybe would want to be a part of helping to take on this disease.
Right. Know that you're always going to be welcome here in Brazil.
Thank you.
And then you've said on your keynote that even after the doctor thought that you wouldn't survive and you had your last rites read, you continued relying on the team that were treating you. And I want to know basically how this confident feeling helped on your recovery.
So early on, I was very confident in my team and also in the medical field in general. In medical school, you're taught about all these diseases that we understand very well. And so you get this sense when you're in medical school that we kind of have things figured out, and that there aren't that many diseases out there that are really tough to control. And so I had that mentality going into my illness. But after probably my second relapse is when I started really questioning it and saying, well, they're just like me, and they can make mistakes just like any of us. So we really need to stomp this disease out through a more systematic way.
Now about your professional life, what are your expectations of research on the network you coordinate?
So right now, I showed a slide that demonstrates how we think the disease works, and then all of the studies we're doing to really uncover exactly every aspect of the disease. Right now, we have 4 studies that are in progress. We have another 4 that we're going to launch over the next couple of years if we raise the money and we get the samples we need. If we're able to launch those 8 studies, I feel pretty confident within 2 to 3 years, we'll know what triggers the immune response to cause Castleman disease, what cell is really the problem cell in Castleman disease, and what's gone wrong inside that cell. And once we know those 3 answers, we'll be able to more effectively target and treat the disease. So I really feel like in the next 2 to 3 years, we really will either have a targeted therapy for those patients who do not respond to the one approved therapy, because there is one very effective therapy that works for a portion of patients, but we're trying to identify therapies for those patients who don't respond to the one approved therapy. And I think that within a few years, we should be able to have additional targets.
Right. And now to end, you've gone through a really rough situation, and even despite it, you continue being a brilliant person, really kind person. And I want to know, how does it feel being named by Forbes and being able to motivate others with your own experience outworking adversities?
You know, I think probably the most important thing was another thing I mentioned in the keynote, which is that it takes an army to change the world. And I think that, you know, with something like the Forbes 30 Under 30 list, they only put one person from a particular initiative. And so I was that person for Castleman's, but I literally have an army behind me. There's literally over 300 doctors and researchers around the world, 38 volunteers across the US. We have a board of directors, board of advisors. We've got, and then thousands of patients that are part of our network. So it's this incredible community that has come together to make progress. And I think that that's something that you as a medical student and that others can keep in mind, that if this was me on my own, we would have accomplished very little. But because I've been able to identify others who are passionate about this disease, we've been able to really make incredible progress.
Right. It was really fast, but thank you very, very much by the answers and the patience.
Yeah, thank you so much. Oops. Thank you.